living in the age of AI. Let's face it, every day brings a new technological advancement and a new conversation about how technology is shaping our lives. One of the most important areas being transformed is medicine, from earlier diagnosis to personalized treatment and robotic surgery. AI is changing the way healthcare is delivered. But with this innovation comes an important question. Is AI helping medicine or hurting it? So here to help us unpack this absolutely fascinating topic, one that impacts us all, is my brother, renowned cancer surgeon, Dr. Anton Bilchik. So Anton, the age of AI. First of all, a very warm welcome on this Sunday.
Hi, Nad. Great topic.
So, it's such an important topic because AI, I call it the explosion of AI. So what are you seeing day to day in your practice?
Well, I definitely am not alone. I think every single physician is experiencing a revolution in information, a change in how we communicate with our patients. It can be frustrating, it can be rewarding. And I think the challenge for us is to try and figure out how best to utilize AI both for ourselves in terms of improving our fund of knowledge, but also how best to explain to our patients how best to use AI, because every single patient I see has looked up their disease, they've looked up their symptoms, and I'm not alone when, as far as just the level of frustration physicians can feel when a patient comes in and they have self-diagnosed themselves. They feel like they know more than you know. They feel like they're in some way you feel like you're being interrogated because they have already so much more information than you do. So it can be quite frustrating for physicians. And so often I find myself saying to a patient, I realize that you've read a lot about your condition, but what you've read may not be relevant to you. It may be relevant to other people. It may be good information. And let's figure out how we can best use that information to take good care of you.
So that sounds like an excellent response. So instead of being angry that the patient has looked things up, because today's podcast is for physicians or for providers as well as for the patient, you acknowledging, yes, I understand you've got all this information, because it used to just be Dr. Google, but now it's Dr. Claude, it's Dr. Grok, it's Dr. ChatGPT, it's Dr. everything else. So there are many, many, many doctors that you're competing with in AI platforms. So first thing is to acknowledge and then say, how do you use it? And are you saying that you can have all this information? It doesn't always apply to you as the patient once you've examined the patient. Have you seen that?
Correct. And I think that that's extremely important, because let's break it down. AI lacks access to your medical context. AI can make unsafe errors. AI also cannot take responsibility for your care. And AI also doesn't have an ongoing relationship with you. And as it is so important for a physician and a patient to have that relationship, AI cannot examine you. Decisions are not made based on just a bunch of questions. AI can also be dangerous. AI may misjudge how serious your condition is and may advise to do certain things or to be monitored over a 24 to 48 hour period rather than seek emergency care. AI can also sound very, very confident and very logical, but AI doesn't have access to your vital signs, your labs, your imaging. There's so much that goes into decision making. And I cannot stress how important it is to have that conversation with a patient and to examine the patient before making a decision. There are so many times that my decision completely changes after having that conversation. While AI may provide the recommended treatment, and that may be the right treatment for one individual, that may not be my decision process may completely change in terms of whether I should do a procedure, how to do the procedure, whether alternative options should be considered first. And so I think that the relationship with the physician is so important and cannot be replaced by AI. I think that I'm not against patients, reading up on certain things, but I think it should be done under the supervision of a physician. It can be comforting. It can provide additional information, but it cannot. In fact, I think it's dangerous to replace the physician as a decision maker regarding your care. And fortunately, there are studies that still show that patients still trust their physicians more than they do AI.
Well, it's interesting because I had a friend recently who said she had a sinus infection, and she says, but she's gone on to Dr. Chat and she's following Dr. Chat's protocol exactly and hopes to get better. She's still not better, that is. But in that case, do you think AI is assisting, or again, is it one of your biggest concerns that you may be misdiagnosing and getting the wrong advice?
I think that you may well be getting the wrong advice, and you may well be, misdiagnosing. You have to remember that AI does not and cannot personalize your care without the ability to talk to you, without the ability to examine you, without the ability to integrate everything that's taken place in your life, previous tests, previous x-rays, previous blood tests, your previous procedures. All these factor in to decision making. And the example you just described of your friend not getting better, there are a myriad of reasons. And so the information that your friend may have got may in fact be harming her or him.
And the other thing is the whole reality of, let's say, antibiotics. So we know that taking of antibiotics should only be taken under certain circumstances, right? It has to be bacterial, not viral. So AI can suggest an antibiotic, not knowing that you've already taken 3 or 4 that year.
Oh, absolutely. And not only that, AI has become so sophisticated that it'll provide you references, or it'll provide you papers that you can read. But again, and so some people look at that as, well, that's validating, that's science. That means that that's gospel. That means that that's the standard of care. And it's now well known that antibiotics that are taken for the wrong reasons or unnecessary antibiotic use can cause significant harm. I mean, the fact that we have, trillions of bacteria within our body that are enormously important in terms of helping our immune system, helping us fight cancer, helping us prevent heart disease. And there is a lot of data that taking antibiotics and neutralizing some of these good bacteria may be putting you at risk for developing other diseases or becoming more resistant to antibiotics. So it's very easy to put in a question into AI. AI then advises you on what antibiotic or that you may want to consider. You then look up a paper, and you read you look up the reference, and that sounds exactly like you. and you somehow have got some antibiotics lying around your house from a previous time. So you think, okay, so it'll save me a visit to the doctor. You take the course of antibiotics when you really don't need the antibiotics, and you've likely caused yourself some harm without even realizing it.
So you've really talked about the risks about using doctor AI. Where has it helped? We spoke about how it can hurt. Where are you seeing AI being very useful?
I think that we're embarking in a very exciting world of science, technology, and medicine, and how to make medicine safer and how to personalize care better, so that not every person is treated the same. Not every operation needs to be done the same way. And I think when we look at what I do, which is complex cancer surgery, and we use robotics, for example, the concept of AI being able to help alert the surgeon that something is about to happen, or do it this way because you could prevent an error, or you could it can help guide the surgeon in certain ways, as it could help guide a medical oncologist in terms of selecting a particular treatment for that patient. So I think there's absolutely no question that AI has tremendous value, and it just continues to get more and more sophisticated. It continues to be built into new technology, surgical instrumentation, and the whole concept of being able to know that that medicine that you're taking is the best medicine for you and it's going to work, versus, well, that medicine is given to everyone that has your condition, but it may or may not be the best medicine for you. So I think that we are definitely going to see how we can improve and make our improve and focus our treatment for each individual in a much more effective way. And that's where AI comes in.
So, something I've been speaking a lot about is what makes you indispensable. And you touched on it, which is AI cannot replace the patient doctor relationship, the somebody caring for you and touching you and seeing you. So, I'd like this part to be talking to those caregivers, those physicians' assistants, those nurse practitioners, because my experience firsthand over the last years, I've seen such a decline in patient doctor relationship. I recently had an experience where the physician had so many people, she was completely frustrated, irritated, that I'd asked a question that maybe was something I'd seen in AI. And her response was that of somebody who was totally burnt out. So I want to talk about what AI can never replace, which is that human connection, and your advice and guidance, because I've had the pleasure of speaking to some of your patients, past and current, who speak about your so-called superb, what we used to term bedside manner, but just the ability to relate. So how do you do that every day under the stress and under the pressure you are? And how do you make sure that you are maintaining that human connection?
So you're talking about three things that are extremely important: human relationships, trust, and ethics. And do you really think that AI cares about you? Do you think that AI has a relationship with you? Do you think that if AI makes a mistake, AI is going to be accountable? So those are extremely, extremely important. And I think, again, one has to also recognize that many physicians are overworked, and they have certain triggers. And a trigger for a physician, when you walk into that consulting room, before the physician has even had a chance to ask you a question or find out how you're doing, is that opening statement, I read on AI that I have, and it drives physicians nuts.
Yes.
So I would, you can think that, and you can come with questions that are based on what you've read. But the moment, and it happens every single clinic, I hear the word, I Googled this, and this is what I found. Now, let me just give you
this. I ChatGPT'd this. I Clauded this.
Right. And so we've got all these terms, and it drives physicians nuts. I mean, physicians are human beings. And so I would strongly recommend that every person, take those phrases out of your vocabulary when you talk, when you're seeing your physician, because it just, you're making your physician feel irrelevant. And as I said, physicians are humans. Now, let me give you an example of an encounter that I had, and how AI caused such stress for a patient and such stress for their family that family members even flew up from another city to come and be with their family member. So I do a lot of liver and pancreas surgery and colorectal surgery, and a patient was getting a CAT scan, was getting one of those smart scans, one of those scans because they just decided they want to scan the whole body. And the scan came back as a pancreas cyst. So first thing that person did was started Googling pancreas cysts, and then started doing, ChatGPT. Well, of course, pancreas cyst then takes you down this road to pancreas cancer, and then the survival of pancreas cancer. Now this person is convinced that they've got pancreas cancer and that they have 12 months to live. And they spiral. They call their family members. The family members fly in to comfort them. But they now have all this information about pancreas cysts, pancreas cancers, and they are beside themselves. They come in to see me, they are hysterical, and I look at the images, I examine the patient, and there is absolutely nothing to worry about, because maybe 20% of the population have pancreas cysts. It's completely benign. It doesn't even, it's not even worthy of being followed. It's just nothing more than a cyst. It is not a cancer. Sure, there are some cysts that can be very large and may have cancer-like features, but those, again, are far less common than just routine pancreas cysts that we see all the time. And that is just a perfect example of how ChatGPT and AI absolutely,
and let's not forget Rock and Claude and
this person just spiraling, and an entire family. And and then when I told them, what are you worried about? This is so common, and we, this is benign. They almost looked at me with disbelief. And then the conversation was, well, I read that, and I looked up this, and I looked at, and I'm thinking to myself, this is, I've said what I need to say. I feel totally frustrated. I'm sorry that you've been through so much. What I'd like to see is just some relief. Great. I'm so pleased, and but it leads to a whole, barrage of more questions that they've read on ChatGPT related to pancreas cysts. So
this is such important information for all of us, both as the patient, but then as the physician, to be able to say, look, I understand you've read it, but you've just explained what none of these platforms provide. is your history, is a physical examination of you. I think that's the critical piece. You also bring up something very, very important, was the way all of these platforms are designed is to make it sound very empathetic. I care about you, great question. And it's to remind all of us that the wording may come across in a friendly way, but that these platforms are in fact not human, and they are not your friend, and they are not your physician. And it's
That's
very
exactly right.
easy to get confused.
That's exactly right. I mean, the human relationship part is so important, and a patient may be referred to me with a certain condition, and I may have a preconceived idea as to what that person needs, and it's not uncommon at all that my treatment plan completely changes after I've had that chance to listen and to talk to the patient and examine them. Just an interesting note. Now, we grew up in South Africa when we went to medical school, we did not have any fancy technology. And the way we made medical decisions was based on talking, listening, and examining. Then coming to America, where there's such a large focus on technology, and I'm involved in a training program, and I did my residency at a prestigious training program. It's not uncommon at all for trainees, when they are talking about patients, they will start the conversation with, the scans showed this, or not the patient presented with the following symptoms, or talking about the person or the examination. They immediately go to the most sophisticated scans, and I often find myself saying, well, why is the patient here? What did the patient say to you? What did you find in your examination? So this again gets back to the human element that cannot be replaced by AI. AI is not going to examine you. AI is not going to, listen to you. AI is not going to show any compassion. AI does not have that, patient-physician relationship, and it'll provide tons and tons and tons of information. And I think that's good. Store it, but do not walk into your physician's office. And this, I mean, listening to your situation, I'm trying to defend the physician. You may have hit a nerve with a busy physician that day, who was trying to get through seeing a whole bunch of patients, get through doing the medical records, and the last thing your physician wanted to hear was the word AI or Google, suggesting that you already know something that they don't. And that's where you talk to all of my colleagues, the word Dr. Google just absolutely hits a nerve. Or now the word Dr. ChatGPT.
Or Claude, or Grok.
Or Dr. Perplexity, or Dr.
There's so many others. That's why I want to make sure we don't vilify one, because they're now so many. I just wanted to touch on something you said. We grew up in South Africa. One thing I do remember is when you went to the doctor, and when we were little, so we grew up in the 60s, 70s, 80s. I moved to America in 1997. The doctor looked at you. I don't even remember our doctor taking notes. They just looked at you, and they listened to you, and they touched you. Now, obviously, with liability, there's this huge emphasis on note-taking and then transcribing. I've had physicians who don't look you in the eye at all. They are so busy typing. So occasionally I want to say to somebody, just a reminder, I know you're busy, but and it doesn't matter whether you are a physician with your patient, if you are a manager with your employee, if you are a server in a restaurant or a patron in a restaurant, just that ability to make someone seen. And I always remind us that the Zulu term for hello is sawubona. Sawubona literally translates to I see you. And do we make people feel seen is one thing that ChatGPT, Grok, Google, Claude may make it sound like they are hearing and seeing you, but in reality, they are not.
Okay, so this is where I'm going to tell you where AI can be and is being used to be very, very helpful to physicians and to the patient. There are tools now, and it's simply saying to the patient, is it okay if our conversation is recorded? Because AI can record your conversation, can then create a very, very comprehensive note. And so you are looking at the patient, you are having that conversation, the patient is being heard, and all this is being captured in a note that then you can edit afterwards. And so this is where AI is really revolutionizing the way we take care of our patients, taking a lot of the time that physicians really don't like, which is having to, and that's the reason why physicians are staring at a computer typing while talking to you, because they don't want to at 8 p.m. have to start charting on 20 different people.
And are you using that? Are you using
absolutely that? So there are a number of when I see a patient, I don't have a computer in front of me. I sit opposite the patient, and I use either that meeting is being recorded and it goes into a note, or I have what is called a scribe. So it's a person who is listening to our conversation and is putting all the notes into a chart so that I can concentrate, so that I'm not staring at a screen. And so there are many ways right now where physicians can be physicians.
And is that confidential? I think the biggest concern is confidentiality. So if you have an audio recorder and it gets transcribed into notes,
it's completely confidential. It's there are various different apps, and it goes directly into your medical record, and it's totally HIPAA compliant. Yeah, it's and there are several. We use a particular one, but there are several of them around, and most major medical centers are now integrating AI into that, so that physicians can be physicians and not. And a lot of the paperwork and a lot of the time that's spent ordering things is now can be automated in a HIPAA compliant way. So that's where AI is certainly being it's enormously helpful both to the physician, and the patient is actually having more human interaction than what you just described, which is a physician staring at a screen and patients sitting in the corner of the room wondering, is this person ever going to look at me or examine me?
And that has happened to me. So if you're just joining us, our conversation today was around, is AI helping medicine or hurting it? And my brother, the brilliant cancer surgeon, Dr. Anton Bilchik, has really helped us unpack the many nuances. So as we end today's conversation, let's just go back to really just to wrap it all up. If you could give one piece of advice to patients navigating this new world of AI-driven healthcare, what would it be?
I would say that AI should function as decision support under supervision of your physician.
And I got your advice as a patient. Please don't make the first thing that comes out of your mouth. I just went on to name the platform and read. You can bring it into the conversation and say, these are my questions, this is my concern. And I think to your point also, as the physician, to be aware that people are going to say it and how to diffuse that if it's a trigger for you.
I immediately, the moment I hear that, I say, please, I understand what you're saying. And I'll often tell them that there are very prestigious studies, such as from Harvard Business School, showing that up to 80% of what people look up about themselves doesn't really apply to them as an individual. So I try and cut it off because it's not to me. It's not in it's not in the
Either of
patient's
your
best
best
interest to be lectured about what they've what they've read up on. In that case, you know, you're coming to see me as the expert. You have to have the confidence that I know about the subject, that I spend a lot of time learning and being an expert in that field. I'm your Google. I want to feel like I'm the person that is, that you've come to get the information from. But don't come to me with all the information that you've looked at from multiple different sources and start lecturing me. And I
But it
think,
sounds like you found a very gracious way of saying to people, look, I appreciate that you've looked all this up, just to let you know what it doesn't give you is your own data. Because, in communication, I always say it's not only what you say, but how you say it. And you certainly have a standard line and a very gracious way of delivering that.
right, because otherwise you're stuck, literally discussing what your patient has, and it could take up most of your meeting with them, and you really haven't even had a chance to find out how they're doing, find out, talk to them about their symptoms, go into their past, spend more time examining them, talking about treatment options. It's actually not helping the patient.
So, one thing that AI cannot replace is the conversation we are having now, is the spontaneous discussion around what AI can't replace. Now, AI could certainly help us transcribe this conversation, push it out on our various platforms, but just that absolute connection that I am so grateful to have with you. So, if you have just joined us at the tail end of this conversation, it will be on replay. If you have concerns or comments, please engage with us about how you've used AI to help you with your health issues, or if you've got a story about something that you didn't know, or anything you'd like to ask. We will address it in our next segment on Live Long, Live Strong, Live Healthy. And just a pleasure to always see you. And I say there's nothing artificial about genuine connection. Thank you so much.
And Nad's happy birthday to our younger brother, Brian,
Dr. Brian Bilchik. Happy birthday.
Happy birthday.